Joining us now, Dr. Monica Gandhi, professor of medicine and associate division chief of the Division of HIV, Infectious Diseases and Global Medicine at UCSF. On hold for now, but how significant is the potential of some of these cuts for ongoing research projects?
So this would have been incredibly significant, and I hope it doesn't go through, because essentially all of a sudden on Friday, there was an order that indirect rates, which are the rates above the budget of a research grant that goes to the infrastructure of a university to help conduct the research, would be slashed from somewhere up to 60% in some institutions to 15% across the board. This means we can't provide the laboratory space, the water, the electricity, the administrators, all the infrastructure and support to do the research. It's part of the research to give indirect rates to universities. It's not bloat. It's not whatever Elon Musk was saying. And the problem is we're targeting cancer research and medical research inefficiency. These are research enterprises that help improve American health. So it's definitely the wrong place to go.
Is there a way, though, I mean, they're looking to be more efficient, to more efficiently allocate some of these funds? I mean, is there a middle ground to identify ways to save, but to also do the important work?
Yes. So what we could do is take time, adjudicate each university's rates, and figure out what's the exact rate that you need, again, above the research grant to conduct the research. It's going to be different for different universities. San Francisco, where I live, has very high rents. Iowa has cheaper rents. It's not going to be the same across the board. But that sort of process, that thoughtful process, is not what's been happening in this administration. There are sudden jerky orders that cause a profound amount of chaos and anxiety, and then it gets overturned because it's not legal. I think this is just not the way that I've heard to administer a government. So yes, I think that we do need to look at the rates and see what's the right number, and it's going to be institution dependent.
And within the medical research community, Dr. Gandhi, what are some of the conversations? I mean, are there folks thinking of leaving and going into a different sector of research with the potential of this, or is it a wait and see? What's the mindset?
You had just given a segment about the CDC. It's not just the NIH, it's the CDC, it's the NIH, it's public health, it's USAID, it's PEPFAR, it's a lot of health programs that are being targeted. This has given a lot of anxiety. And the thing about the NIH is it supports research across all fields: cancer, HIV, infectious disease, cardiovascular, lung. So it wouldn't be that people could go into a different field of research. This is the government organization that funds research. We are responsible for probably the NIH. I mean, 69% of discoveries. Like, it's amazing how much progress goes through the NIH for a $47 billion budget, and how it improves human health. So there'd be nowhere to go unless you got supported by private industry. And a lot of people in research want to do objective research. They don't want to be under a drug company. They really want to be completely independent and do good research, which is what the NIH supports. So yeah, it caused a lot of consternation, because it's not over yet. It was a temporary stay over the weekend, about where are young people, young investigators going to go? Are they going to go into research under this chaotic of a scheme?
Yeah. President Trump is a businessman, and, businessmen and women look for a return on investment. What would be the argument or the message to him on the research and the fruition of some of the research and what it has been able to achieve thus far, and the rate of some of the things that you all are working on that would help bolster the case?
The NIH has such a great return on investment. So there was a piece yesterday by the National Academy of Medicine that really went over all this, that I can send to your viewers. But essentially, U.S. contributes to 69% of global research and development. NIH-funded research contributes directly to the U.S. economy, $60 billion to America's GDP, because it supports 7 million jobs. NIH-funded discoveries regularly lead to new drug development and new economic activity across all states. It's really that drug development that changes people's lives, because suddenly someone can have a longer lifespan with cancer because of the clinical trials that were conducted by the NIH. So there's very nice analyses of return on investment that I think of all the organizations that DOGE is trying to target, NIH has some really, really good outcomes. And because we do such rigorous research because the NIH demands that rigor, it really improves the health, just not of Americans, but of everyone worldwide. We are the main organization that advances health worldwide. So I definitely would recommend looking at this National Academy of Report just put up yesterday about the return on investment from NIH funds.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.